first start by explaining to our audience, what is Alzheimer's disease?
Sure. Thank you so much, Laura, for having me on the show today. Alzheimer's disease is the most common type of dementia in the United States. Alzheimer's disease is an irreversible and progressive deterioration of the brain. People with Alzheimer's disease have functional deficits. They're unable to tend to their home. They make mistakes on their bills. They start having problems with their medications and managing their health needs. As the disease progresses from the mild stages through to the more moderate and severe stages, people have more and more difficulty managing their bodily functions.
What would you say to a family member, a caregiver, who's trying to take on all of the burdens of the patient, and they have good intentions, but they're simply not able to do that all on their own? But they want to because that's their family member. They know their family member. What would you tell them?
That is a very common problem. It is really difficult to take care of a person with dementia, especially as the dementia progresses and their person's care needs increase. I would want them to know that the distress they're experiencing is very typical of what other caregivers experience. What starts in dementia as maybe just putting someone's pills in a pill box or reminding them to pay their bills ultimately progresses to daily physical care, including bathing, changing people's soiled undergarments, getting them dressed. So I would want caregivers to know that it's not a sign of weakness and that they're not betraying their loved one if they involve care to take care of this person, and really getting extra care into the home, especially, again, as I said, as the disease progresses, is the reality of dementia care.
On the Visiting Nurse Association website, there is helpful information about when to seek help. Can you give us a little bit of an idea of what those items are, those signs are we should be looking for?
The Visiting Nurse Association's blog addresses some of the aspects of the disease that are really difficult for family members to cope with. That is often a time where you need to involve either a geriatric case manager or a private home health aide, especially if the family is unavailable to help their loved one do some of these things. The blog mentions wandering. That's where the person gets lost. Literally, they step out of their house and they get lost in their neighborhood, or they go to drive their car and they go to the grocery store, which maybe they've gone to for 20 years, and they get lost going to the grocery store. And finally, the blog addresses something really important, which is the stress or the strain that caregivers are under when they care for their loved ones with dementia. And sometimes they really do need to pay, even if it's just for a few hours a week, for private care so they can get a break, tend to their home, and even tend to their own healthcare needs.
What are some of the home health care options available for someone with Alzheimer's, and is it covered by most insurance?
So that's a mixed answer. So most health insurances, including Medicare, will pay for short-term home care services, especially after the person has either been acutely medically hospitalized, they've had a surgery, or they've had an intercurrent illness, something like COVID, for example. These home care services that companies like Visiting Nurse Association provide can include nursing care, physical therapy, occupational therapy, speech therapy, and a limited number of home health aid hours. However, unless the person has either long-term care insurance or Medicaid, ongoing long-term home health aid support, whether it be live-in or live-out, is not typically covered by private insurers or Medicare and needs to be paid out of pocket. At Visiting Nurse Association, we have very skilled social workers who can help families figure out what entitlements their loved ones might qualify for.
How can the caregiver make sure that they're at their best when managing this really complicated disease?
Being a caregiver is a really hard job. We know that caregivers have more health problems and higher rates of depression and anxiety. The caregiver is basically managing two people's lives. They're managing their own life and that of their loved one with dementia. They can't isolate themselves. They need to cultivate their relationships with family or friends. They're going to need a lot of social support, especially as the illness progresses and the care demands for their loved one increase. There are support groups that they can go to. The Alzheimer's Association has them virtually right now, where they can realize that they're not alone. And other caregivers are also struggling with some of the same things, that the caregiver is not an island unto themselves. So there's all sorts of resources they can pull in, whether involving visiting nurse association, whether involving friends or family, whether involving someone like me, a psychiatrist who can help. And they need to use those resources. It's super important. It really does take a village.